Good afternoon, and thank you all for being here today. As you can see, Dr. Joe Cantor is with me. Today we're also joined by Stephanie Flood. She is the commander of the Disaster Medical Assistance Team that's been dispatched here to Louisiana from the Department of Health and Human Services to provide staffing support for Our Lady of the Lake Regional Medical Center. We also have Ebony Addison, who is a nurse practitioner at West Jefferson Medical Center. In fact, I think Stephanie and Ebony are both nurse practitioners. But Ebony works at the West Jefferson Medical Center, and she's been on the front lines, and she's going to share what her experiences have been. And then we also are joined today by Dr. John Van Cherry. He is a professor of pediatrics and director of community outreach, testing, and vaccination at LSU's Health Science Center in Shreveport. For emerging viral threats. He's going to be able to share what he is seeing in North Louisiana. As you all know, on Monday we announced the temporary return of a statewide mask mandate aimed at curbing the spread of this devastating fourth surge of COVID. That order did go into effect on Wednesday. It goes through September 1st. And I want to thank those who've stepped to the plate, put their masks back on, and are being part of this team effort to slow the spread. I also want to thank the businesses who are doing their part because they want to protect their employees and their customers and their communities. And they also know that this is a targeted temporary mitigation measure that is specifically designed to keep our economy open. These press conferences, while I hope are informative, obviously they alone aren't going to slow the spread of COVID. Words have to be followed up with action. And really that's where the people of Louisiana come in. We need everybody to do their part to mask up and go sleeves up. On Monday, we wanted to convey the severity of the current COVID situation in Louisiana, and it is severe. We are at the leading edge of the surge. Case growth per capita in Louisiana continues to be the highest in the country. We're the #1 state. That's not a distinction we want to have. And quite frankly, it's not even close. The #2 state is Florida. With a percent positivity on our test that continues to go up, meaning we have no reason to believe in our data that we've reached the peak or that we're coming down. Case growth continues, hospitalizations continue, and of course, deaths as well. We have reached a critical point. Things, if anything, are worse today than they were on Monday. And I believe that that message has been received by the vast majority of the people of Louisiana. If you read any newspaper, watch or listen to just about any national news program, and you're going to see reports from Louisiana, interviews with doctors, nurses, or families who are suffering. So unfortunately, the eyes of the nation are largely on the state of Louisiana right now. We have more children sick with COVID-19 than at any other time during the pandemic. And as we heard from hospital leaders on Monday, particularly Dr. Klein, the pediatrician from Children's Hospital in New Orleans, the Delta variant is affecting children at a greater rate than during the surges that we saw previously. For example, at Children's Hospital in New Orleans right now, I believe there are 13 children hospitalized with COVID-19, including 6 under the age of 2. 4 children are in intensive care, and they include a 3-month-old boy, a 23-month-old girl, an 8-year-old girl, and a 17-year-old boy. This disease is impacting children and adolescents across the full age spectrum. And of all of the patients in the hospital there over the age of 12, and they're eligible for vaccination, none have been vaccinated. On Monday, I told you that 2,079 children had tested positive per that day's report. Since that press conference, in just 4 days, another 3,939 children, these are people below the age of 18, have tested positive in Louisiana. That means this week, more than 6,000 children tested positive. So in light of that, and the CDC recommendations, the recommendations of the American Academy of Pediatrics, the information that we've received here from the Office of Public Health and leading Louisiana pediatricians, and quite frankly, as a parent myself, I have to ask, why wouldn't we send our kids to school with a mask on? For their benefit and to slow transmission generally in the state of Louisiana. And we know better than to continue to believe that kids can't and don't get sick from COVID-19. And we certainly know better than to believe that they're not getting infected and that they're not infectious. And when they leave school, they go home to parents and grandparents and into the larger community. And any holistic effort to slow the spread of the virus, which is absolutely paramount right now, in light of all the things we're seeing across the state of Louisiana, simply has to include these young people. And that's especially true when you think about the fact that 0% of kids younger than 12 are vaccinated. Only about 13% of those between 12 and 18 years old are vaccinated. So all of the numbers that I'm about to give you are headed in the wrong direction. Percent positivity for a COVID test remains high and increasing. It's currently at 15.4%. The previous measure was 13.2%. Today, we're reporting 6,116 additional cases of COVID-19. We are also very sadly reporting 48 new deaths. That's more than 200 deaths this week that we've reported since Monday. We have 2,421 individuals in the hospital. That's a net increase of 71 since yesterday. We broke the all-time record that we've had in Louisiana on Tuesday, and each day since then we have gone up. And I can tell you the indications are we will go up by more than 100 more for tomorrow's report. 277 of those patients are on mechanical ventilators. That's an increase of 19 since yesterday. And it is because of these grim statistics, coupled with a shortage of nurses and hospital staff, that we asked the federal government to send medical strike teams our way. I am extremely appreciative and grateful for the assistance that we have received, and quite frankly, it is nowhere near enough, and we continue to ask for more assistance. And I will remind you, we had a nursing shortage in our state before the pandemic started, and certainly before this surge started. In fact, there are about 7,500 open positions for registered nurses, nurse practitioners, and vocational nurses across the state right now. And further exacerbating that is the fact that we have nurses and respiratory therapists and other healthcare professionals who themselves are out of commission right now as they attempt to recover from COVID-19 and get back to work. So while we appreciate the assistance we're receiving from the federal government, and we continue to ask for more, and we believe we will receive some additional assistance, it simply won't be enough. And that is why we have reinstated the mask mandate for indoor public spaces when social distancing is not achievable. And that's because we have to slow transmission. If we don't slow transmission, the cases will continue to grow, the hospitalizations will continue to grow, and so will the deaths. So we have 3 goals right now. And this is the point that we stressed in the Unified Command Group meeting this morning. They are to increase vaccinations, to slow transmission through proven mitigation measures such as universal masking, and surging our staffing capacity in Louisiana so that we can continue to deliver vital life-saving care to both COVID patients and non-COVID patients alike. I do have hope. I mean, I know we're going to get through this. How quickly we get through it and how many people get sick between now and then, how many people die between now and then, is largely going to be up to us. But I do have hope, and one of the reasons is over the last month, those individuals choosing to be vaccinated, receiving their first shot of the vaccine, is up by more than 300%. Now, we start off at a very low level of vaccination, and so we have a long way to go. But I am heartened by the trajectory that we are currently on, and we have to continue that for some time. More than 2 million people now have received at least one dose of the COVID-19 vaccine. That's more than 43% of the people in our state. Only about 37.5% of our state is fully vaccinated, however. You know, and sometimes it's helpful to compare ourselves or contrast ourselves with other states. We did have the second lowest percentage of the population vaccinated in the country for a while. Now we're basically tied with Arkansas, and there are 3 states behind us. I guess that indicates we're making progress here, but of course these other states are continuing to make progress and are really rather focused not on comparing or contrasting with other states, but just doing everything that we can do here in Louisiana, because we have a lot more progress that we need to make. I too want to thank the employers in our state who've taken upon themselves to come up with creative ways to promote vaccination among their employees. Bollinger, for example, has launched their own lottery program based on what's happening in Louisiana now. I think people see just how transmissible and bad the Delta variant of the virus can be. So it's time that Louisiana shows them how we can fight back. And we know the tools that are at our disposal. Let's use them. Let's embrace them. Today, there are more than 1,400 locations in Louisiana where individuals can get their COVID vaccine. So I encourage you, do it. Do it today. This week, we actually had to order more vaccines than we've been ordering in the past because individuals are choosing to receive their vaccine. And I think Dr. Cantor pointed this out previously. Most of the people being vaccinated today have changed their mind. At some point in the recent past, they had decided to continue to wait, or maybe they had decided they weren't going to get vaccinated at all. And I welcome that. I would encourage everyone to understand that today is a new day, and no matter what you've said or no matter what you had decided before, in light of all the medical evidence of the safety and efficacy of the vaccines, in light of all of the evidence is just how serious and transmissible and deadly the Delta variant is, it is time to reevaluate and change your mind and talk to a medical professional if that's required in order to get all of your questions answered so that you can be comfortable making that decision.